Here we can see the superior and inferior parathyroid glands. So the superior and inferior parathyroid glands are ovoid bodies and they are 6 mm in greatest diameter. They are 4 in number, so there are 2 superior parathyroid glands and 2 inferior parathyroid glands. They are closely related to the posterior border of the thyroid gland, which is lying within its facial capsule. Now let's talk about the 2 superior parathyroid glands. So the 2 superior parathyroid glands are more constant in position and they lie at the level of the middle of the posterior border of the thyroid gland. And now let's talk about the 2 inferior parathyroid glands. They are not constant in position, so they may lie within the facial sheath or outside the facial sheath, or they may be embedded in the thyroid substance, or they may also be in association with the inferior thyroid veins caudal to the thyroid gland. So in the thyroid substance caudal to the thyroid gland, or they may also reside in the superior mediastinum of the thorax. The blood supply of the parathyroid gland is closely related to the blood supply of the thyroid gland, and it is superior and inferior thyroid arteries which supply the blood to the parathyroid glands. Superior thyroid arteries are going to arise from the external carotid arteries, and inferior thyroid arteries are going to arise from the thyrocervical trunk. Now let's talk about the venous drainage. It is going to be superior, middle, and inferior thyroid veins. Now let's talk about the lymphatic drainage. It is going to be deep cervical lymph nodes and paratracheal lymph nodes. Nerve supply is going to be CSG, cervical sympathetic ganglia, superior and middle branches.